Morning, good afternoon, or good evening, depending on where you are. My name is Anshu Banerjee, and on behalf of Queen Dubé and myself as the co-chairs of Align MNH, I would like to welcome you all to the opening forum of Align MNH. Nearly 2,000 of you answered the call to join us for this opening forum from over 100 countries. The next 2 days will set the tone for a decade of dialogue, ongoing engagement, and collective action to drive progress for maternal and newborn health and well-being and prevention of stillbirths. Align MNH provides us with a multifaceted platform, offering us the opportunity to not only come together over the next 2 days, but remain in touch and get back together repeatedly over the next 10 years, building a movement for collective action for maternal and newborn health. The road to 2030 will be a hard-fought journey, and we will hear more from Queen Dubé, who will set the scene in a few minutes. Following her introduction, the program aims to be solutions-focused, building on data-driven discussions, including on the effect of COVID-19 on services for mothers and newborns. We will look at global, national, and subnational data to track and review progress in meeting the needs of mothers and newborns and stimulate discussions on success factors and strategies for overcoming challenges. We will provide greater insights into the drivers of success and the need to prioritize and sustain quality maternal newborn health services in the face of COVID-19. Align MNH takes a holistic, integrated approach to the maternal newborn health agenda, recognizing that the mother and baby cannot be separated if we do not only want them to survive, but also thrive. This emphasizes the critical need for the maternal and newborn health communities to come together to accelerate progress. During the next 2 days, there will be therefore also the opportunity for networking, allowing attendees to build relationships and establishing shared goals. Now is the moment for the maternal newborn health community to come together to track progress, share successes, and support one another to address challenges and accelerate positive change. I'm looking forward to the discussion over the next 2 days and hope you'll be able to take home practical solutions to questions you had before the forum and got answers to. It is now my pleasure to introduce Dr. T, my colleague on the Align MNH Steering Committee and our Day 1 facilitator.
Thank you so much, Anshu, and good morning, good afternoon, good evening to all of you joining us from all over the world. I'm thrilled to welcome you to our first ever opening forum of the Align MNH Collective. My name is Dr. Tlaleng Mofokeng, but you can call me Dr. T, and I'm joining you all the way from South Africa. And I'm excited to serve as your Day 1 moderator for this important convening and proud to be on the Align MNH Steering Committee. Now, during this opening forum, we have the opportunity to gather the maternal and newborn health communities together, sharing ideas and approaches to accelerate progress on the journey to 2030. Just a few housekeeping items before we get started. We will be active on social media throughout the proceedings and welcome you to engage with your fellow attendees. Our forum hashtag is #CollectiveActionMNH, and our Align MNH handles are @AlignMNH. You will notice that you have simultaneous translation occurring from English to French. If you wish to hear the sessions in French, please click on the interpretation function on the bottom of each session. All session recordings and presentations will be accessible to audience members after the forum. If you experience any technical difficulties at any time during the forum, please click on the Help tab above and someone will be there to assist you. Many troubleshooting responses can also be found on our frequently asked page. We also invite you to take the advantage of numerous networking opportunities. You can now see who else is attending and participating alongside you and can direct messages to those fellow attendees under the Community tab. You can also attend several networking sessions at the end of each day and prior to the start of day 2. And finally, you will see that we have done our level best to pre-record the majority of our sessions over the next 2 days. This was done to avoid technical glitches, but also to accommodate and ensure the equitable participation of each of our speakers who are currently in multiple time zones throughout the world. We also wanted to allow the time and space for a live Q&A with each of you. Please also note the Q&A box immediately to the right of your video player and type any questions that you may have. We will do our best to respond to them in the time we have allocated to our live Q&A panels, but we'll also be answering them live throughout the proceedings. So don't think it is odd when you are watching a speaker presenting and also typing back to you in the chat box. We are taking multitasking to a whole other level. With that, it is my pleasure to introduce you to our keynote speaker, Dr. Queen Dube. Dr. Dube is a consultant pediatrician, a clinical epidemiologist, and chief of health services at the Ministry of Health in Malawi. She is also one of our fearless Align MNH Steering Committee co-chairs, and Dr. Dube has worked as both a healthcare provider and government representative. But above all, she is a mother, a daughter, and a sister. She will share with you why now is the moment we must take action for mothers and newborns. I wish you all an inspiring 2 days. Get to know one another, have conversations, share your thoughts and experiences, and definitely ask questions. And with those words, I will turn it over to Dr. Dube.
Welcome. Good morning, good afternoon, depending on where you are today. Very big thank you for being here today. Today is important. Tomorrow is important. The days, the weeks, the months, and the years ahead of us are very, very, very crucial. This opening forum calls for a different way of thinking. We do need to think differently. Looking at the data, if we continue with business as usual with the current trajectory, it will take 110 years to reach the SDG 2030 targets in neonatal mortality and under 5 mortality. 110 years to do what is needed for us to accomplish in 9 years' time. We are talking about 2030, which is 9 years from today. And as we speak, by close of business today, we will have lost 800 women across the globe from preventable causes related to pregnancy and childbirth. This unsettles me a lot, and I'm sure it unsettles most of us. The time is now, because there is a light at the end of this very dark tunnel. But this moment calls for us to think differently, think outside the box. How do we accelerate the reduction of maternal and newborn mortality? How do we accomplish that which, if we continue with business as usual, will take us 110 years? How do we do that in 9 years? The goodness is we've known that we can achieve the highest impact through care at birth and care of the small and sick newborn. And yet, despite the evidence, this is where we have the lowest coverage and the highest equity gap. Why do we have silos? Silos within each level of the health system. Silos amongst our health workforce. Silos within our resources. Resources ring-fenced for TB, ring-fenced for HIV, ring-fenced for malaria. And some of this is actually donor-driven. We've actually known that interventions that will save a mother will also save a baby. We actually don't need silos. We need integration. We need zero separation between the mother and the baby. even before that baby is born. For example, issues around safe motherhood. We are really talking about the mother. And then we have different programs for the newborn. If we mix the interventions that save the mother and the baby, the health worker on the ground will look after the mother and will look after the baby using the same level of resources. Some of us have taken divergent roads. We have overcome challenges and have had successes. We've been learning how to maintain and adapt our services in the midst of the ongoing COVID pandemic. We are learning to be resilient. COVID caught all of us unawares, whether you are in the developed or the developing setting. We're all learning each passing day. And I have seen that with the resilience that COVID has brought in our systems, we can actually do it. If you look at all the health system building blocks, we can do it. We've been able to recruit staff at the shortest time period. We've been able to procure equipment. We've been able to establish robust data systems that at a touch of a button, at this very same second, I'll be able to tell how many new COVID patients we've had in Malawi. I'll touch the same button for Afghanistan. It is amazing what we've been able to do with COVID. And COVID has provided some positive disruptions. It has shown us how we can prioritize services in Malawi. I mean, I'm sure it is the same across the globe. As I mentioned earlier, every day at the end of close of business, every day our Minister of Health stands in front of the nation and looks at how many have turned out to be positive for COVID on a daily basis, how many have died, their ages, exactly where. Meaning to say we can do exactly the same for maternal and newborn health. There is no single COVID death that goes unnoticed, not just in Malawi, but across the globe. Yet, why did we and the global community not look at the data like this for the women and the babies dying each and every day? Is it because we've been comfortable with the way things have been as a maternal and newborn community? COVID has pushed us to increase budgets. As I said, hire people at record times. I talked about equipment. We've even pushed our engineers to innovate around things that can be used within our environments. It's taught us to be accountable for every death that has occurred. People have said these are important people that are dying of COVID. We've lost presidents, we've lost ministers, we've lost members of parliament. But every human life is equally important. Every mother, every newborn is equally important. Did we not value them and their lives in the same way? Because the same adaptations that we've made and prioritized could have been taken care of yesterday. Perhaps today we shouldn't have been talking about survival as an SDG target. Maybe we could have been talking about thrival for the mother and the newborn. We were able to put electronic systems in remote places where network is an issue. Yet we cannot do the same for maternal and newborn health. We just haven't paid enough attention. We need not be comfortable if we want to achieve much more than we've been able to achieve in the last decade for the mother and their newborns. If we just care about the mother and the newborn, yes, we can do it within 9 years. The maternal and newborn health community must come together. We all came together, rallied around the COVID pandemic. We need to do exactly the same to address obstacles such as inequities in service delivery, low coverage for cost-effective interventions such as exclusive and early initiation of breastfeeding, issues around lack of quality of care, respect for maternal care. We need to move beyond the policy to implementation. We need investments, investments, and investments in data, in infrastructure, in personnel, and the evidence we must implement. We need to reflect on the recent recent findings on maternal mortality ratios and neonatal mortality rates with COVID. There's a lot to talk these days about decolonialization of global health. What does it actually mean? Essentially, what we're talking about is that countries, whether it's in Asia, in Sub-Saharan Africa, in Europe, they need to feel that they are part and parcel of the agenda, part of the solutions. On the research side, we spent several years gathering the evidence. However, the agenda has been driven from the global level down to the country level. There needs to be more science driven from the bottom up. Countries should feel like they are part of the research agenda. Remember sitting in one of the webinars where Professor Joy Lorne alluded to the fact that only 1% of the publications in the journals, the first authors, are from Africa. Yet the bulk of these research studies are actually happening in Africa. There should be a concerted move to build the capacity of in-country researchers. You want ownership of a research agenda? Let's support researchers from Africa, from Asia, Latin America, and the Caribbean. We need to have an agenda that is driven from the countries in which the work is happening. The African Academy of Sciences is supporting indigenous regional national organizations. This is really, really critical and really important for us. Don't researchers have us lead the research. We need to have networks within the regions that are tackling the maternal and newborn agenda. Support innovators at the country level. The neonatal unit I was working on, we're able to innovate, a couple of interventions from phototherapy lights to low-cost syringe pumps. But if we have more research on these innovations, we could have proven and promoted these local solutions. If you look around, innovation is happening. It is time that we support it. We do need government accountability. I recently moved to a Minister of Health, wearing a different hat as a policymaker. And gaps around holding our governments accountable are huge. How do we get governments to be part of the recommendations for a way forward? Is it just a signing part? Or how do we hold them accountable? We know that the global guidelines not just magically result into implementation. As I said, we need to hold governments accountable to be part of the solution, the design, the investment, and how they're measuring progress together with the global community. The international community has a large role to play in working with country governments, researchers, members of the health workforce, community members, and more. Collective actions mean all of us. And as such, Align MNH helps to bring us together for collective action with one ultimate goal: to save the lives of women and children, regardless of where they're coming from. To have women and children not only survive, but thrive. The moment is now. If we cannot do it now, there will never be a better time as now. Having learned from the COVID pandemic, we know even in the most difficult health systems, we can push and accelerate the agenda. We need to make sure that everyone has access to high quality, rapid sharing of learning and evidence. And that's what the Align MNH is all about. There is tremendous amount of research ongoing, and pandemic has taught us huge lessons. What about service integration and access to care? We know there are things that other countries are doing very, very, very well with amazing results. Where is a platform where these can actually be exchanged and other countries can learn from? We need to figure out how to harmonize existing platforms. Often the global maternal newborn health efforts appear disconnected, and Align MNH is there to bring us all together. All the information that is available, there is need for a central location where all this can be accessible. There's actually a few opportunities for MNH stakeholders to engage, discuss, and as I said, share implementation experiences. but also share how we can make our governments accountable. Well, have I made you uncomfortable a bit? I hope not, but I also hope you have been uncomfortable. We can achieve more if we're uncomfortable with the situation that we're in. We've been comfortable with how things have been happening for way too long. We need to push the boundaries. Let's demand collective action. Demand that every woman and child's life is precious, and that one preventable death is one death too many. I hope you're inspired today, tomorrow, and in the days to come to think outside the box and not to accept the status quo. Let's challenge one another over this opening forum. Let's listen, let's learn, and let's act. Collective action for maternal and newborn health begins with a new moment like this. Welcome once again, and looking forward to an amazing 2 days. Thank you.
Wow, thank you so much, Dr. Dube. That was absolutely inspiring, and I love just hearing your experience as a healthcare provider, but now as someone who's working in governance. And I hope that we can all really commit ourselves to think outside of the box and challenge one another to listen, learn, and act over the next 2 days and beyond. In fact, I'm pleased to announce that Dr. Dube, alongside many other authors and the steering committee members, have a viewpoint that was just published in the Global Health Science and Practice Journal. It serves as a galvanizing call for collective action to accelerate progress towards achieving health and well-being for women and children. And it demands that the MNH community more rapidly and effectively share learning, new evidence, and program experiences. You will find a link to the viewpoint now in the chat, and I welcome all of you to read it. We would also like to test your knowledge with a quick poll, and at the top of this video and in the chat, you will find a link to a poll, and please select one option as we test your knowledge. And thank you to all of you who have responded to this poll. And the correct answer is 62. The correct answer is 62. And now we would like to play a short video that highlights the data on maternal, newborn, and stillbirth deaths, and why we are here today and tomorrow to discuss the challenges we face in the road ahead, and serves as a rallying call for the maternal and newborn health communities to come together to accelerate progress. Here's the short video.
Every day, more than 800 women die from preventable causes related to pregnancy and childbirth. Each year, across the world, 2 million babies are stillborn. And in 2019 alone, 2.4 million children died in their first month of life. We have the evidence. We know what interventions work. We can and we must change this. Globally, we have made progress. Each year since 2000, there have been declines in the average rates of maternal mortality, stillbirths, and neonatal mortality. However, while some regions have made hard-fought gains towards the maternal and newborn mortality targets of the 2030 Sustainable Development Goals, others have met challenges and are lagging behind in one or both areas. If current trends persist, more than 60 countries will not reach these targets by 2030. With a global pandemic threatening to stall our efforts, we have remained resilient, but there is still much work to be done. and we must take a comprehensive approach to achieve the SDGs. Maternal and neonatal communities must come together, as the goals cannot be achieved without collaboration and knowledge sharing. Maternal death, stillbirth, and neonatal death often have common causes, and many deaths can be prevented with the same interventions. High-quality antenatal services, childbirth services, and postnatal services. Yet, only half of women have essential contacts with these services, and among the poorest women, only 40% receive 4 or more antenatal visits, delivery care, and postnatal care, compared to 75% of the richest. Almost all women will make it to at least one antenatal care visit, but visits are often too late, too few in frequency, and too limited in quality. And as many as 40% of women experience stigma and discrimination during childbirth. We know that the lives of 3 million mothers and newborns could be saved each year with universal coverage. But knowing isn't enough. There is a critical need for the maternal and newborn health communities to come together to accelerate progress. Right now, more than 40% of countries will not meet all 3 2030 SDG targets. To achieve the SDG targets, the survival rate of women and babies needs to be increased at an even faster pace than in the last 2 decades, especially in sub-Saharan Africa, where mortality rates need to decline by at least 5% per year. With only 9 years remaining, urgent collective action is needed. Because if we don't all make the SDG targets, then none of us make it. Whether you are a global supporter, a government official, a researcher, a program manager, a healthcare provider, or a community worker, your experience and your voice matter. We are resilient. We have the science and evidence to guide us. Now, it's time to act. At this opening forum, we are all here to reaffirm our commitment to the 2030 SDGs, to share and build on our diverse knowledge and experience, and to uplift the women and children in our communities. Because we all know what's at stake.
Thank you for staying with us and welcome back to the Align MNH Day 1. And accompanying that video is a new report from our colleagues at Countdown to 2030 for Women's, Children's and Adolescent Health by UNICEF and the WHO that has been produced specifically for the Align MNH Opening Forum. A link to the report and the video you just saw has been put into the chat box, and both will also be available on the Align MNH website following the forum. And what a great introduction to our next plenary, the road to 2030, new challenges and new opportunities to accelerate progress for maternal and newborn health. And we have the science and the data, and here to talk about what the next 9 years to 2030 would look like is our wonderful panel moderated by Zoe Mulan. Now, Zoe is the editor-in-chief of the Lancet Global Health, and we will now see a short video followed by Zoe herself on the virtual stage.
Welcome, everyone. to this opening plenary of the Align MNH Forum. I'm delighted to be chairing this panel discussion as Editor-in-Chief of the Lancet Global Health. I've been with the Lancet for a long time, and maternal and neonatal health has been a passion of mine for the great majority of that time. My interest was piqued by probably the first themed series of papers that I worked on. That was maternal survival back in 2006. That series took the relatively radical position at that time that every woman should be enabled to give birth in a health facility with a skilled attendant. 5 years later, I was involved with a groundbreaking series on stillbirth, which highlighted in a really powerful way this really hidden tragedy. As we know, unlike maternal and neonatal mortality, stillbirths were not mentioned in the Millennium Development Goals and are absent from the Sustainable Development Goals also. Yet we know that there are cost-effective interventions to prevent all three. And in fact, another initiative I've been involved with at the Lancet through their publications has been tracking the coverage of these interventions for nearly 2 decades. That is the countdown to 2030 for women's, children's and adolescents' health. And we're really privileged today to have the director of that initiative, Dr. Thies Burma, with us on the panel. In more recent years, I've worked on a series on midwifery, which really opened my eyes to the unique role these professionals play in maternal and neonatal health, as well as the prevention of stillbirths. Again, we're really lucky to have the president of the International Confederation of Midwives with us today, Franca Cadet. Finally, a few years ago, I oversaw the publication of the Lancet Global Health Commission on high quality health systems. Now, while this report went well beyond maternal and neonatal health, the message was very relevant to this sector, where we now know that getting women into health facilities to deliver is not enough. The quality of the care received is vitally important, not just for individual outcomes, but for trust in the health system as a whole. I'm really grateful that Dr. Leah Tadesse, Minister of Health for Ethiopia, and herself a trained obstetrician, has also made the time in her schedule to join us today. So over to some exciting and engaging questions for our panel. I'm going to start with Thies. So as the director of the Countdown to 2030 initiative, and also you're at the University of Manitoba in Canada, Countdown was a key contributor to that opening video we all just saw that illustrated how countries are progressing towards the SDGs and where efforts remain. What are some of the most revealing themes that your data are telling or not telling us? And what do you see as some of the biggest challenges and opportunities for data measurement and tracking of progress?
Thank you very much, Zoe. I think that one of the big opportunities that the Align MNH platform is offering us now is to consider maternal health, stillbirth, and newborn health in an integrated manner. As we saw in the video, that only 2 decades ago, out of every 100,000 births, there were as many as 340 maternal deaths and 5,200 stillbirth and newborn deaths combined. Since then, we've witnessed an incredible decline to an estimated 210 maternal deaths and 3,100 late fetal and newborn deaths together. And because fertility also declined, the numbers of deaths went down even more. Spectacular progress, never seen before in the history of humankind, I think. But we're still far from the 2030 global targets for the Sustainable Development Goals of 17 maternal deaths and 1,200 stillbirth and 1,200 neonatal deaths per 100,000. And to reach those targets, the rate of progress has to be much faster, and especially in sub-Saharan Africa, several parts of Asia, and among the poorest populations everywhere. So are we ready for the big stride forward? Align MNH and other initiatives have focused or are focusing on the most dangerous period of life, the first 48 hours surrounding labor and the day of birth, when nearly half of maternal death and 40% of all stillbirth and neonatal death occur. Surely, as societies, we can guarantee 48 hours of high quality care to welcome each newborn to the world. And this means every woman and every baby need to receive high quality routine care and have access to emergency delivery care at all times. As the video and the accompanying countdown report also released at this forum show that the use of antenatal delivery and postnatal services is increasing almost everywhere, but the poorest are still left behind quite a lot. And the positive coverage trends are no guarantee for good quality care for all. There's much room for improvement of the quality of care during pregnancy, delivery, and postnatal visits. And in that, data can play an instrumental role in driving progress towards maternal and newborn health for all. Not only from household surveys, as we've been relying on very much, but also from other sources that can provide actionable information, such as health facility data. Now is the time for a reset in what data are collected and used for action to make a real difference. Thank you.
Thank you, Thies. Minister, over to you now. As a representative of the government, you've witnessed firsthand how challenging it can be to maintain essential maternal and newborn health services with disruptions in the face of COVID-19. Can you share with us how the government of Ethiopia focused on women and newborns by adapting the health system to be more resilient and sustainable? And what were some of the areas of focus that the government prioritised to ensure access and quality of care and to protect these vulnerable mothers and newborns?
Thank you very much, Zoe. It's a pleasure to be in this great panel focusing on this important topic of mothers and newborns. And indeed, as you said, maintaining essential services during any emergency, and especially such a pandemic, is challenging, but really crucial to avoid disruptions and protect the progress achieved in recent years, especially in reducing maternal and child mortality. As a country, although our first response had focused on COVID itself, like I'm sure any other country, we then took quick action to protect essential health services as part of the COVID-19 response and recovery effort. So while we had the COVID task force that was overseeing the whole response as a country under the Ministry of Health, we also established, I think, a few weeks into the pandemic, a non-COVID services task force that worked along the COVID task force with the ministerial leadership. And we developed an implementation guide to maintain essential health services. But we had to prioritize when we said essential, especially reproductive, maternal, neonatal and child health services, nutrition, as well as some chronic illnesses like HIV and TB that were prone for disruption. And we, of course, then mobilized extra resources from donors, government, other private funders to not just for the COVID response, but also to avail critical supplies like PPEs, which were crucial for the continuity of these services, and initiated weekly virtual meetings with all our regional health bureau heads across the country and visited facilities across regions so that there is frequent communication. And then, of course, in parallel, we also try to address demand side issues through public communication campaigns, because people were afraid to come to health facilities, especially to receive crucial essential services for mothers and newborn. So addressing fear was another strategy through communication. And in addition to the media, we also used community health extension workers, especially the urban ones, to go for house-to-house service and create linkage to facilities. And monitoring and evaluation on the uptake of services was critical. And at the same time, we also did a national assessment on especially focusing reproductive and maternal and child services, which showed in the first few months that services had declined around 10 to 30%, but this had quickly recovered, although of course disruption was harder to improve in urban areas. But we, of course, fear that challenges could be harder going forward, given that we have increasing number of COVID cases and IDP conflict in the different parts of the country. And there is a need to collectively plan and give the needed attention and investment in our health system, both nationally and globally, on the way forward to protect the vulnerable ones. Thank you.
Thank you very much indeed, Minister. Franca, over to you now. So you understand as a midwife the critical need for maternal and newborn health communities to come together to accelerate progress. What is the role of midwives in bringing the two communities together? And what are the returns on investment we could expect to get in exchange?
Thank you so much for that question, Zoe. And it's been really great to listen to Tis and to Leah and their stories. I think it's so important as well that we're here together and to hear these different things at the same time. As ICM, and for those who don't know us, the International Confederation of Midwives, we are 142 associations worldwide in 124 countries. We represent more than 1 million midwives. And we have a theme every year. And interestingly, our theme this year on the 5th of May, so write it in your agenda, the 5th of May, the day of the midwife, we actually have as a theme, follow the data, invest in midwives. And that is so what we're kind of discussing here now, because rigorous evidence shows that midwife-led continuity of care, that really does give us the best results. And midwife-led continuity of care doesn't mean midwife ruled. Midwife-led means that you use the philosophy of care of midwifery, but you work in a team, you work with others, that every woman has access to a midwife who is highly educated, but where you can also build that personal relationship. It's that combination of head and heart. And we know that that's the quality care that women need. And I'm convinced that if midwifery were to be a medicine, it would be implemented worldwide. We would all use that medicine if that was called midwifery, just like we see a lot of evidence coming on all kinds of obstetric interventions that is often implemented immediately. But somehow with midwifery, that's harder. And we can understand, because of course, I think, we have been picking a bit of low fruit. Midwifery is an investment, a long-term investment, and it is investing in primary healthcare. It's investing in relationships, and I think that does take longer. That's not a quick win. But I think, when you talk about the return on investment, my young boy, my youngest child, he's about 20, and when I told him that the return on investment on midwifery, on midwives, was 16-fold, his eyes started to twinkle. He couldn't believe it. He kind of thought, well, where are these midwives that we can invest in? And a new evidence that has been produced in the Lancet, or published in the Lancet last year, supports this evidence. And it very much says the same thing. Interestingly, it reveals that by 2035, if we had universal health coverage of midwives, it would reduce. And these figures, I read them time and time and again, and I think, maybe they got it wrong, but they haven't got it wrong. Universal health coverage of midwives would mean that by 2035, you would reduce 67% maternal deaths, 84% of newborn deaths, and 65% of stillbirths. And then you could say, well, maybe that's a bit overambitious, universal health coverage. I don't think it's ambitious. I think it's a duty. But say, for example, we were to reduce, invest in midwives and have 10% more midwives worldwide, then in 5 years' time, you would see 22% reduction in maternal deaths, 23% of newborn, and 14% in stillbirths. So, what can we say? We obviously need to invest in midwives. And that doesn't mean that it's for midwives. I am a midwife, and I know what midwifery is about. It's for women. We need to invest in women, and that's why we have to invest in midwives. Thanks.
Thank you. Yes, I think the evidence is fairly clear. But thank you for reading out the numbers again. They are amazing. So Minister, back to you now, if I could. Can you share some more of your perspective on the importance of government leadership and accountability in order to reach the SDG targets? And what role do international partners play or should play improving access to quality care and the collaboration and accountability necessary at the country level? And maybe touching on one of Franca's points there, how does financing fit into it, or how are we going to invest in these necessary elements?
Thank you, Zoe. Indeed, without leadership and accountability for results from government, achieving a strong health system and achieving SDGs is very difficult. In the past, maybe 20 years or so, our country had a strong political commitment, as well as demonstrated, of course, through increased financing and focused program to combat infectious diseases like malaria, TB, HIV, as well as maternal and child illnesses, with strengthening health systems, which has saved countless lives. And part of this success was aligning donor support around government priorities. So the government, together with international partners, developed one plan and one strategy with the aim of having one budget allocated to this harmonized national plan. We aligned donor resources, including most donors putting their resources into our MDG, now SDG pooled fund that is used to finance these government-led interventions. And results are monitored also jointly with one data through using the HMI system together with partners. So this has helped us achieve most of the MDGs, but still there are gaps in financing, and achieving SDGs requires more resources. As we know, available donor financing is reducing globally. So our new way of working has now to shift away from a focus of only development assistance to an approach that aligns donors' resources, but also supports capacity to develop domestic financing and innovative resources for service delivery, including engaging the private sector in a synergistic way. But at the same time, also looking at how efficiently we are using our resources to advance our priorities and improve outcomes, especially the focus on mothers, children, and adolescents to meet the SDG targets. So to that end, our directions for the next 5 to 10 years focuses on transitioning to a more sustainable health financing, which can be achieved again by reprioritization of health within government budget and increasing general government expenditure according to the Abuja Declaration, which we are not there yet, and also by directing more income and consumption taxes towards the health sector and other innovative resources, while at the same time donors supporting better efficiency of existing health expenditure to make our investments more sustainable.
Thank you very much. Franca, back to you now, and I'd like you to be candid with us, if you would, and share what you feel would be the consequences of not coming together to support the mother-baby dyad. So if we don't keep our focus on workforce strengthening, how likely are we to achieve our 2030 goals? And what does this pandemic reveal to us that perhaps we knew all along, but now have the data to support it, both quantitative and qualitative?
Thank you so much for that, Zoe. Well, I think the consequences of not investing is that we will not reach the Sustainable Development Goals, and we know it. And actually, some figures do show that if we go on the way we're doing now, we might reach the goal of 70, the maternal mortality ratio to 70 per 100,000 by 2065. I think that is even optimistic. So no, I think we will not achieve it. And what we also need to be careful of is we're talking about increasing or supporting the workforce, as was shown in the video. And I think all of us have said it. It's not only about increasing the workforce, so having more workforce, it's about having the appropriate workforce. You know, it's access. I think one of the big mistakes we've made in the past, we've thought access, going into a hospital, into an institution, that would actually reduce the deaths, and it has to some extent, but it's of course not the walls of a hospital that give care. It is the people in that hospital that give the care, and it is actually the right people with the right skills, and not only the right skills but also the right attitude. I think respect is extremely important, and sometimes we see it as like an additional extra, but actually when you start with respect, the rest will follow. But if you don't start with respect and only look at wanting to keep someone alive, respect might not follow. And we do want women to come and their partners. So I think that kind of increasing the quality care is extremely important. We really need to look at quality care for women. It's what women have a right to. And I also think that in some ways, as I said before, we have been investing in some low-hanging fruit in many ways, or we've been picking some low-hanging fruit. I think we need to invest in the long term. We need to invest in primary health care. We need to invest in women in the long term and make sure that women can really take control of their lives. So it's quite a complex issue of many things at the same time. It's not only healthcare. It is many things at the same time. And I think that the pandemic has really, really reinforced the fact that certainly as ICM, we've done a lot of work with our midwives and listened to the midwives globally. And we find that there, where the midwives are integrated in the community, are a part of the community and really close to women, giving kind of personalized care, it looks as if the pandemic has not affected that as much as has some of the institutionalized care. And I think that should really be a message to us, small scale, close to women. That is so, so important. And we do find that when you do give that kind of quality care, somehow that investment is more solid. And I think that too is extremely important. And one more point, which I find really interesting, is the fact that I do feel healthcare has become a commodity. And I do think that healthcare professionals too, at times, with funding, healthcare professionals seem to at times have to push each other to try to get funding. And so for that, we're in competition with each other and wanting to show that one might be better than the other. And I think that governments, I think that donors, everyone should support us to make sure that we give the right care, the evidence-based care to women, and that it's not us having to kind of push each other to give the right care. Thank you.
Absolutely, a real coming together in all senses of the word. So Tees, back to you, please then. So on the one hand, this pandemic has seen both the need for a data reset, but we've also seen a sort of data revolution. What has COVID really driven home for you in the sense of local routine health information systems and the role of global actors and international partners as we continue to emphasize the importance of data? So what would you really like to emphasize to the audience in terms of data being critical to our collective goals for collaboration and knowledge sharing, and how will joint metrics help us on this countdown to 2030 and bring us closer to achieving our goals?
Yeah, indeed, the COVID pandemic has resulted in data everywhere. It's a flood of daily figures on new cases, mortality, hospitalizations, and more that we get, and many more data than our memories can retain and reproduce. But can we use this unwanted pandemic as an opportunity to change the level of playing field for data and evidence on MNH? And I think we can. 4 points. First, the COVID pandemic has generated a wave of interest in routine health facility data to document the impact on the continuation of essential health services. The routine data on pregnancies, deliveries, and newborns are critical to obtain better local and real-time information about the use and the quality of care. And a recent 5-country study of the mBirth group, published in Lancet Global Health, I believe, showed us the way, how the quality of the maternity registers in hospitals is good enough to obtain several indicators with potential to improve and expand. So these routine data can be instrumental for local action and accountability, and the COVID pandemic has really stimulated much more interest in this area, fortunately. Second, COVID makes us more aware of the importance of mortality data to guide public health and healthcare decisions. The longer-term goal is a fully functional birth and death registration system, including stillbirth, causes of death, for all countries. But in the meantime, sample registration systems should be established to fill the mortality and cause of death data gap, with special efforts to ensure complete reporting of perinatal and maternal deaths. Third, Counting and auditing every death in health facilities is essential for effective learning. Maternal and perinatal death surveillance and response systems need a major boost to overcome common implementation challenges. Perinatal death can be included, as shown in high-income countries, but probably best in a well-supported sample of health facilities to ensure good data quality. And lastly, facility surveys are needed to monitor service provision, data quality on a regular basis. And here too, I think the COVID pandemic may provide impetus with countries starting to use regular phone or web-based surveys to monitor facility services. So there are some real opportunities for us to do better in MNH in the short future. Thank you.
Excellent. Thank you so much for that. So finally, we'll move on to the last question, which is a general question for all of you. So if you could each in turn give me a quick 1-minute response. So I'd just like to ask, why are you excited to be here today? And what's the most pressing topic or thought that you want our attendees to keep forefront in their minds as we embark on the next 2 days of this opening forum? What does collective action for maternal and newborn health mean to you? So I'm going to go back to Thies for the first one. Thank you.
I think we have been treating maternal mortality, stillbirth rates, and neonatal mortality as separate issues for too long. And time is right for a renewed major stride forward in maternal and perinatal health and survival, based on an evidence-driven approach for local action and accountability. Data should be used across the whole spectrum of maternal and newborn health, including stillbirth. And we can use innovative and improved approaches, such as the one that I just talked about in the context of the COVID pandemic, but also improvements in surveys with full pregnancy histories and greater use of digitized longitudinal registers for each mother-child dyad, so that they're followed and that action is taken based on good information. So fortunately, we can generate now better evidence to guide a data-driven, all-out effort to reduce maternal and perinatal mortality further and faster in the near future, so that we can come very close to the 2030 goals in all countries, and for the poorest especially. Thank you.
Thank you for that. Franca.
I think you can somehow imagine, Zoe, what I might say. I think the most pressing thing is that if we care about the health of women, we need to invest in midwives. And what I really can see in this, in kind of these 2 days of Align MNH is that that's not just being said by midwives. It should be just said by midwives. It should be said by all of us. And midwives need to be at the center of an integrated approach. I also hope that when it comes to the data, we will be looking more at qualitative data, not only quantitative data, because sometimes quantitative data can push us towards over and under medicalizing. So I think qualitative data is so important. And I'm really excited to see this trickling through. It is trickling through slowly, and it gives me so much hope for the future. And we really need to support this change, all of us, every single one of us. I think we need to make sure that we ask midwives to the table, but not only ask us to the table. Let us speak and hear what we're saying, because I think the most empowering thing for midwives, and often it's said midwives need to be empowered. One way to empower midwives, listen to us. We have a lot to say and we have good care to give. And together with women, we can make the change. So I am excited and I'm hopeful.
Thank you. Thank you very much. Minister Tadesse.
Thank you. It is clear that investing in mothers, in women, in newborn and children has a huge return of investment. And of course, globally, we've taken a long time to really realize that in how we invest in health and how we invest in these interventions. But we have seen progress, so we have still a long way to go in terms of achieving those SDGs. But we have to also recognize that the time where we are now, we are at risk of really stalling or reversing the gains that we've had so far due to this pandemic. So it is critical to acknowledge this, and coupled with reduced availability of resources globally, donor resources for countries, and the economic downturn that may force governments to reduce funding to health, we need to recognize this risk of reversing gains that we've had in the past decades, and collectively come together to find ways, innovative ways to advocate for more financing, and also aligning those available finances towards clear investment cases in women's health, in newborns' health, which are government-led, so that we can collectively not only maintain the gains, but also achieve the progress we are envisioning through the SDGs for better health of women and children and the vulnerable population. Thank you.
Thank you, everyone, for that really engaging discussion. Right, so now time for some questions. Thank you very much, everyone, for sending in so many questions through the chat. We'll try and get through as many as we can. I've been jotting a few down. I think I might ask the first one to Tees. This is a data-related question. Susan would like to know what efforts are ongoing currently to enable widespread facility-level data collection that's acted upon within countries.
Yeah, I think that there's a lot going on. I think COVID, as I said, has really stimulated the interest in facility data, and ministries of health have been trying to use those data for annual reviews, for district performance assessment for many years. And they're keen. The problem has always been the quality of the data. How good are the data? Can we really use them to estimate, say, coverage of deliveries by hospitals or antenatal care, etc.? And there one really runs into problems. WHO, UNICEF, and others have produced tools that allow us to look better at data quality. And I think the now use of web-based platforms, electronic data sets, DHIS2, many of you are familiar with, is really a step forward. Now with COVID, we start to look at monthly data, so much more action-oriented, regular data. So I think there is a lot of opportunity to do better, but it's still a bit fragmented. And what we have to be very careful that it's not just, if COVID goes away, hopefully, that also these efforts sort of die off again and we go back to business as usual. I think we need to bring those together, build capacity in countries to strengthen those analysis. And this is what we're trying to do with the countdown, for instance, trying to have good capacity for looking at quality of data, making adjustments, and producing the best possible estimates for districts, for provinces, and national level of MNH indicators and other indicators.
Minister, did you want to add anything on that question from your point of view in country? So that was what efforts are ongoing currently to enable facility level data collection that's acted on within countries.
Yes, absolutely. Data quality and data use have been our focus areas in the last maybe 4 or 5 years. And within the pandemic, this has really shown how much crucial data is. And strengthening the health information system from the lowest health system level, like the community and the extension program, the health posts that we have, up to all hospitals. We've been trying to work on improving the quality at first, because we need to have the right kind of data, timely and complete data, but also the use of the changing the culture of the use of data, which usually has been, the trend has been to collect the data for reporting purposes, for decision making, maybe at only the highest level for policymakers, but not so much at the facility or service delivery level. So we've been trying to work hard to change that culture, so that there is decision making based on those service delivery points, using the data they generate to improve quality of services at health centers, hospitals, clinics, using that data not just for reporting purposes. So we called it the information revolution for the last maybe 5 years in our strategy, which we have continued to work on. And of course, the integration of digital technology to enhance the use of the data, and especially the timeliness of it, and the completeness of it is really assisted through technology. So these are also areas we've been trying to work on, but ensuring the use is not just for big policy level decisions, but at each service delivery level for quality improvement, I think is crucial.
That's really good to know. Thank you for that. There's a question here from Anita about whether there are any data on whether home births have increased during the ongoing pandemic. And I can actually probably answer that question, because we published a paper last week, I think, a meta-analysis that showed that no, this was a different study, apologies. We published a study from Nepal several months ago, which showed that institutional childbirth had decreased by more than half during the early stages of the pandemic, when Nepal went into lockdown. So I guess we can infer from that home births have indeed probably dramatically increased in several countries. And the meta-analysis that I was referring to then also showed that there'd been a consequent increase in maternal deaths and stillbirths in several countries around the world. So that's really worrying, and that really puts into perspective the need to focus on maternal and child's health services through any emergencies in the future. And related to that, there's another question from Winfred to Franca. What are the opportunities for bringing midwives closer to homes?
I love that question, Zoe. And interestingly, what you say about home birth increasing, I think it has in certain places in the world. And it's not the home that is, of course, not safe. It is a system that makes home unsafe, just like an institution can also be unsafe. So I think we do need to remember home birth in itself doesn't need to be unsafe. But if there's no quality care within the system to provide safe home birth, then it becomes unsafe. And I think that what we have learned from this is that women are afraid, I think at times for the wrong reasons, maybe for the right reasons. Maybe they do realize that the hospital is not as safe as they wish it to be. And I do think that we need to make sure that we do get close to where women live. You know, often it is said, oh, you know, some certain women, they live so far away, but of course women don't live far away, but we are often far away from women. And I do think, and we do see that care that is integrated close to women is much more solid and seems to survive better these kinds of pandemics. So I do think we could look at regions where it is possible to try to increase safe home birth. But of course, women should be allowed to choose their option for birth shouldn't be driven by fear. Their option should be driven with good information and of course with safety. And I do think that this is something we can definitely learn from this. And I think in many ways listen to women, because obviously these women are saying they fear something in the hospital. And we need to look at that. And it's interesting, an earlier question to me, you asked me about the mother-baby dyad and how can we kind of get mother and baby together. If we had listened to women in the first place, babies and mothers would always have remained together. It's not mothers that want babies and mothers to be separated. It's actually us healthcare professionals and institutions that have separated mothers and babies. Mothers want the mother and the baby to stay together. So in this case, we needed to listen to women. And I think now again, let's listen to women. And the pandemic has shown us that we are still not prioritizing sexual reproductive health and rights, just like we didn't do it before the pandemic. We haven't during the pandemic. Midwives have not been given PPE. Many other healthcare professionals that are serving women who are also able to have COVID have not been given PPE. And I think we really need to look at those kinds of issues and basically listen to women and follow their lead, because they don't say this for nothing.
Thank you very much, Franca. Tis, another question for you. Marty would like to know, what indicators do we use to establish that mothers and babies are thriving beyond just surviving?
So I think there are in the sort of global strategy for women, children, and adolescent health about 60 indicators along survive, thrive, and transform. And there are quite a few on thrive, including indicators related to nutrition, stunting. So I would refer to that full list. But if we were in a meeting where we were all sitting together, I would have waved my hand and say, I want to say something about those home births, whether it has increased or not. So if you allow me, Zoe, just to come back to that point, because the initial evidence, there were quite a few studies that, so in the first month when the pandemic just started, that had decreases in home birth, some 10%, 20%, increases in home birth, so less institutional birth, probably less cesarean sections and so on that were needed in quite a few countries. But what we've also seen in the past, and I think what we're beginning to see now, there's also a rebound that is quite quick. We also saw that with Ebola, which was, of course, a devastating epidemic in West Africa. So I think while we are focusing on using, the possible dips or documented dips, which is very unequal between urban and rural areas and within countries, I presume, but as a way to advocate and warn that we need more attention for maternal newborn health in this context, we should also keep in mind that there are 3 million deaths now due to the COVID pandemic in a year. We have nearly 5 million maternal stillbirth and neonatal deaths in the world every year. And I think that's a figure that in itself should be so shocking to everyone. Of course, we've been saying it for so many years, but let's also keep that bigger picture, whether or not a decline in the services is occurring. And I think we need to work with countries to document that and advocate using the information as much as possible. But let's also keep the big picture in mind, which is highly unequal.
Yeah, thanks for that perspective. That's important, and thanks also for the additional information on the rebound effect. You mentioned nutrition there in the thriving indicators, and Marty has a question about the role of malnutrition in maternal mortality, stillbirth, and neonatal mortality. Would anyone like to just remind us how crucial this is in this situation? Who'd like to take that one? I'll pick on someone.
Well, I can start with something. I mean, obviously, maternal nutrition is hugely important for both the health and survival chances of the mother herself, as for the risks of stillbirth and newborn health. I mean, countless babies are born with low birth weight, prematurity, which is one of the leading causes of deaths of newborns. And so I think maternal nutrition plays a huge role.
Could I add to that, Zoe?
Go on.
Sorry, could I add to that? I think another thing which is very important, of course, with nutrition is breastfeeding, and that we really need to make sure that women are supported to be able to breastfeed long term, because that is such a strong basis, a first basis for a child to go into life. And I think that during the pandemic, certainly we've seen that at times disinformation have made people not breastfed or not being allowed to breastfeed long, or women have been removed from their babies. And I think that that part of nutrition, sometimes when we think of nutrition, we think of food, we forget the breastfeeding. And it's extremely important in making a good start in life.
Yeah, agreed. Okay, we probably have time for one more question. This is a question from Grace, who asks about how we can facilitate better teaching in our institutions, by which I think she means universities or training institutions, rather than the seemingly never-ending in-service training. Who would like to take that one? Maybe Minister, and then Franca, you can have the final say.
Thank you, Zoe. The pre-service training, quality in pre-service training is a crucial foundation for the quality of health services we give, especially for all services we give, particularly in mothers, newborn, and children. And it is especially about ensuring it's competency-based, but also focusing not just on skills, but on the right attitude, because we can only inculcate that through a strong pre-service training program, rather than fix those in other in-service trainings, which is usually difficult to do in a short time. So the skills they get, especially with the needed infrastructure, the needed capacity building of faculty, and like simulations and the right infrastructure is really crucial. But a huge emphasis I would also put is on the attitude aspect and the ethical aspect of it, on compassionate care for women, for children is really a crucial aspect, where emphasis is needed for the respectful care we envision to achieve in our training programs.
Thank you. Franca?
I find it so promising to see how in Ethiopia so much accent has been put on respectful care, and you see what the result is of that. So my big compliments to you, Minister. It's really great to hear that. I do think that education, kind of the basic education of midwives, is extremely important when you do midwives, education of all healthcare professionals, and also for us to understand the context within which we work, so that we know, so that in our pre-service training, we are not only educated in our area, but we also understand what the context is. So what are the other community workers, for example, or traditional birth attendants that are there that can be a very important bridge to women, so that we really work as a real team, not only within the healthcare professionals, but also broader than that. I think for midwifery, it's important, direct entry midwifery, using the essential competency so that you have the same level, that you're well registered. But again, the philosophy of care, which is also what the Minister says, really understanding the philosophy of care, understanding teamwork, understanding respect, and also, of course, also having the medical skills, and learning that in pre-service training, and then having the opportunity for a career pathway, whereby you can kind of learn year long. I think this is really, really important, that we support each other as a team as well, that we're able to do this. And I think that's the right way forward for all of us professionals.
That's a great way to wrap up. So thank you all very much for engaging with those questions. I'm really sorry there were loads more questions coming in as we were talking, and I wasn't able to get them to them all. But you have all our contact details on the forum website, so please feel free to reach out to us directly if you have anything burning to ask us. So thank you very much for engaging with this session, and enjoy the rest of the conference.
What a brilliant discussion. I really enjoyed all of those different perspectives, and great start to this forum. Folks are really taking Queen's challenge to be bold in our approaches to achieve accelerated progress. TIES encourages us to consider how we can use this unwanted time of the pandemic as a reset in what data are used for action. With COVID, data is everywhere. In fact, we've heard each of our speakers reinforce the importance of data both qualitative and quantitative. We've also heard about how the high yield return on investment in midwifery and appropriate workforce that can support and respect the needs of women and newborns. And Franca, a friend and a fierce advocate for midwives and the healthcare workforce, stated it simply and very well. Start with respect and the rest will follow. And Dr. Leah reminded us of the critical importance of government leadership and accountability to make progress. She encourages us to align resources around country-defined priorities and plans. She also reminded us of the hard truth we all face. If we do not focus our attention now, we risk reversing hard-fought gains. So thank you, Zoe, and to all of our panelists for your excellent insights.